In Part 2A, you followed the steps to locate a code in the alphabetic index for acute upper respiratory infection. Before you continue, make sure you have watched Part 2A and open the ICD-10-CM coding reference manual to the first page of the tabular list. The tabular list is Part 3 of your ICD-10-CM coding manual. It is divided into 21 chapters. Each chapter covers either a body system or a group of conditions. To verify the code, you must locate it within the appropriate chapter in the tabular list. You can use the contents page in the tabular list, but there is an easier method. An easy way to determine the chapter for your code is to look at the left and right margins on the pages in the tabular list. Notice the margins display the chapter number and a range of 3-character codes, starting with an alphabetic letter. In this case study, the first 3 characters of the code are J06, so pause the presentation and turn to the chapter that contains those first 3 characters. You should have turned to Chapter 10, Diseases of the Respiratory System. All chapters are divided into subchapters, also referred to as blocks. The first page of each chapter has a table which includes the list of blocks. The blocks are a range of codes with a similar diagnosis. For example, block J00 through J06 have codes that describe acute upper respiratory infections. To locate the code in the tabular list, find the page in the chapter that includes the first 3 characters of the selected code from the alphabetic index. Pause the presentation to locate J06 in the tabular list. You should have found J06 acute upper respiratory infections in the multiple and unspecified sites in Chapter 10 of the tabular list. The first 3 characters of the code represent the category. Codes listed under the category are referred to as subcategories. You will learn more about subcategories in a minute. Continue to look under the category until you locate an entry that matches the code from the alphabetic index. Pause the presentation to locate subcategory J06.9 in the tabular list. Read the definition of the diagnosis in the tabular list is to make sure it matches the diagnosis in the medical document. In this example, acute upper respiratory infection unspecified matches the diagnosis in the medical document, so you can move on to the next step. In Step 6, you will read and be guided by instructional notes. Instruction notes in the tabular list clarify information and provide additional directions for the coder about a condition. There are different types of instructional notes in the tabular list, one of which is referred to as inclusion terms. Inclusion terms refer to conditions that may be the same as the diagnosis or may be conditions that also use the same code. For example, the medical conditions highlighted under subcategory J09 are inclusion terms. Another type of instructional note is an excludes one note, which is a new type of instructional term in ICD-10. For this type of note, remember the phrase "not coded here." It's used when 2 conditions cannot occur together. Since the medical documentation from the case study does not reference the conditions listed in the excludes one note, ignore the note for now. You will learn more instructional notes as you continue to assign codes throughout this course. Step 7 is to assign the code to the highest level of specificity. Coding to the highest level of specificity means you should continue to look for additional subcategories that reflect the etiology, anatomical site, or severity of the condition of the diagnosis from the medical documentation. In addition, you should refer to any specific chapter guidelines that apply. You will learn more about the chapter guidelines later in this course. Since there are no more subcategories for this condition, you would assign the final code, J06.9, for this case study. So what does that code mean? As you recall from the introduction video, all ICD-10-CM codes have a specific format. The first 3 characters before the decimal is the category. In this example, the first 3 characters, J06, represents the category. The 3 characters after the decimal are referred to as subcategories. These characters represent the etiology, anatomic site, and severity of the condition. In this example, the character 9 is the 4th character. Although an ICD-10-CM code may only have 3 characters, most have at least 4 or 5 characters.